What's going on, guys? This is episode 8, and today I'm going to go over different settings that you can work in as a licensed physical therapist and what the median annual salary looks like in these different settings according to BLS. My name is Jin. I'm a second year DPT student. If you guys haven't seen my other videos already, if you are a pre-physical therapy student trying to gather more information, if you're a DPT student that's looking forward to your clinicals, just like myself, or if you're someone that's just interested in the profession of physical therapy, you've come to the right place. I also plan on going over personal experiences in 5 different clinical locations that I've worked in as a pre-physical therapy student during college in a future video. But if you want to ask questions now, you can leave it in the comment below and I'll be happy to answer the questions. I would also like to mention that this isn't an extensive database of all the physical therapy settings that PTs and PTAs or PT techs work in, but these are some of the main ones. Alright, number 1, outpatient orthopedic clinics. This one may be well known to most of you guys out there already, but it's usually where patients go after they get discharged from hospitals or if they had a recent orthopedic surgery. Physical therapists now also have partial direct access to patients in all 50 states, which means with some expectations, patients can go directly to an outpatient clinic that's owned by physical therapists or where physical therapists are the only medical professionals working at the clinic alongside PT aides and PT techs. The main goal of DPTs and outpatient clinics, I would say, would be to help patients return to their normal lives by addressing their deficits. It's also important to be able to refer your patients out to appropriate medical professionals if you see any red flags during your initial eval in an outpatient setting. So if you're working as a DPT in outpatient clinics, and that could range from private outpatient clinics to rehab facilities where there's a lot more therapists working there, like speech therapists and occupational therapists, your median annual salary according to BLS is $85,000. I'd like to re-emphasize that this category covers a whole variety of physical therapists out there, and which state you work in and what setting you work in, whether it's suburban, urban, or rural, matters as well. Next one is sports PT, and this field is very versatile. You can own your own clinic where athletes come to you to receive rehab, or you can work as a team physical therapist with major sports teams across the country, or even college or high school teams. Definitely an exciting field to be in, I think, if you're a big sports fan and you have opportunities to work with some high-level athletes as you make your way up. BLS doesn't have a category specific for physical therapists that work in the sports med field, but I saw from various online sources that the median annual salary could range from $84,000 to $130,000. Home health is another setting that physical therapists can work in. As a DPT, you're going to your patients' homes, and they're usually patients that are homebound, meaning they're doing well enough to not have to receive acute care in hospitals, but not quite ready for outpatient clinics yet. According to BLS, their median annual salary is $94,000. But I know that the salary for home health PTs vary depending on the contract you have, how many patients you see a day, along with many other factors. Next up is skilled nursing and residential care facilities. And this includes nursing homes and long-term care facilities where patients receive rehab and care geared towards promoting independence and improving quality of life. Physical therapists' median annual salary in subacute settings like nursing homes and long-term care facilities, where you're most likely be working with geriatric population, is $95,000. And finally, we have hospital settings, including state, local, and private hospitals. Here, physical therapists provide acute care, and from what I've heard, you definitely get more exposure to medically complex patients. Median annual salary for physical therapists working in hospital settings is $91,000, but I'm sure there's a big range in the pay scale here as well, depending on the location, what kind of hospital it is, and other factors. There are so many more settings than these 5 that I've listed so far, of course. To name a few more, there's neuro, travel PT, pediatrics, pelvic health, prosthetics, research, and many more. But today I focused on these 5 different physical therapy settings that DPTs might work in after they get licensed and what the median annual salary looks like for these PTs according to BLS. Hope you guys found that helpful. If you haven't already, please click subscribe and I'll be back with more videos. Thanks for watching.